Hi James, my name's Michelle. I read about you on the Ridley and Hall website and noticed that you specialise in continuing care. Unfortunately, I'm in a position where we are having to look at a care home for my nan, and I don't really know much about it. I know that there are costs, and I firstly wanted to know if you could tell me what help there is to pay for care home fees.
Hi there, Michelle. Thanks for getting in touch. You'll have read, obviously you've looked into Ridley and Hall before contacting. I'm a solicitor and a partner here, and I specialise in NHS Continuing Healthcare Funding, but I can give general advice about care fees. And I think you're quite right to ask this question because it's something that I don't think is. There's some good information on charitable websites like Age UK about care home fees, but it's a complicated system and it can be difficult to understand. I'm really sorry to hear about your gran. It's got to be a difficult time, and it's also a time when, you know, in addition to trying to make arrangements for her and make the right decisions for her, you've also got these financial worries in the back of your mind as well.
Yeah.
So broadly speaking, there are two sources of public funding that are available for people who need care, and this is in a care home. It can be in your own home. The setting of the care isn't so relevant to the question of funding. Now, those two public bodies are the local authority and what we call the NHS Clinical Commissioning Group. Now, the local authority are responsible for meeting your social care needs and making sure that you're safe and that your care is right. And generally, that they will provide funding, but it will be on a means tested basis, and that involves undertaking a detailed financial assessment. A lot of people won't qualify for this assistance, not least immediately, because generally, unless your capital assets, and that includes things like your home, savings in bank accounts, if your capital assets are above £23,250, then the local authority will probably say that you're not eligible for means tested assistance. Those financial assessments can be complicated, and if your circumstances are unique or your assets are unique, it's worth getting some advice about that from somewhere like us. But generally, a lot of people will fall into the category of self-funding, and that's the term that people are familiar with. But what a lot of people don't know is that the other side of things, I mentioned the NHS Clinical Commissioning Group, I'll call them the CCG for short. The CCG is the NHS body that's responsible for commissioning care in your local area. And that involves paying GP surgeries to operate and commissioning care for people who need a care package. And this can also involve a care package at home, but also in a care home. And it doesn't necessarily mean the care package itself changes, but the CCG's responsibility comes from the extent of your or your loved ones, in your case, your gran's healthcare needs. Mm-hmm. And if your gran, following an assessment undertaken by the CCG, is deemed to have what's called a primary health need, then she is eligible for full NHS assistance. Legally, the NHS must take responsibility for that care package because her primary need is healthcare, and because healthcare has to be provided for free. And so the next question then is, well, after this assessment, you get told you do or don't have a primary health need. Well, what on earth does that mean? But really, and perhaps it's worth us having a chat about that, and I can answer any questions you have about that. But really, it's a case of knowing about it in the first place, and even just asking for an assessment for it from the CCG.
Okay, that's helpful. You did mention at one point continuing healthcare funding. What is this, and how exactly does it work?
So continuing healthcare funding is the name given to the package that the CCG awards a person following this assessment of their needs. And the way it works is you may contact the CCG directly. You can find their details online on behalf of your gran, and you might say to them, you know, look, my gran is at this crucial point. These are her needs, whether she suffers from dementia or has mobility issues, whatever those may be. And you would be saying to them, could you undertake a continuing healthcare assessment for my gran? There are lots of pressure points during the process. I don't know if, Michelle, your gran has recently been in hospital.
She has, yes.
She has. So, clinicians on the ground in hospital and social workers should be in tune with this. And if they suspect that somebody needs a continuing healthcare assessment, they should make that referral. But unfortunately, it doesn't always happen, and families have to be clued up about this and ask for it. Now, in terms of what it is and how it works, so once the CCG undertakes an eligibility assessment for your gran, they'll basically look at her needs across several, almost a dozen, what we call care domains, ranging from her cognition needs to her behavioural needs to her skin, mobility, continence, lots of other things. The idea is they complete a document called a decision support tool, which you can find on the internet, which forces them to capture as much information about gran's needs as possible. And thereafter, they'll look at the care that's needed to meet those needs. And what they're interested in is not so much that your gran has dementia or that she's immobile, but more what needs she has as a result of that and what level of skill is needed to meet those. The guidance requires them to come to a judgment as to whether her needs are intense, complex, or unpredictable, which requires them to make a professional clinical judgment. And if they feel, or at least the guidance says that if there is evidence that her needs are intense, complex, or unpredictable, then the guidance says that may indicate eligibility for continuing healthcare. And so in that instance, the multidisciplinary team who undertake that assessment should, in those circumstances, then recommend that you're eligible for NHS Continuing Healthcare Funding. And in practice, what happens is that when you are found to be eligible, the clinical commissioning group then will take over responsibility for your gran's care package. And if she's not in a care, if she or any person isn't in a care home yet, that might prompt some discussion about what the care package should be and where it needs to be, whether in a nursing home or elsewhere, and then to fund it. Or if the person's already receiving the right care, but they've been found to be eligible, then the NHS just simply needs to take over funding that care package. And obviously for some people in good nursing homes, this could be £4,000 to £6,000 a month. Worth of funding. So it's really important. So although not everybody is eligible for continuing healthcare, it's something that your gran and you as the family should be aware of, because I mentioned these trigger points where people should get referred for assessment. It doesn't always happen. And, it's such a valuable source of funding. And legally, if you have a primary health need, it absolutely should be happening by law. So it's always worth giving some thought to it, even if it turns out that following an assessment, you're not eligible.
That's very, very helpful, James. Thank you so much. And it may be that I come back to you if I have any further questions, if that's okay.
Not a problem. I'm glad you found it helpful. Take care then.
Thank you very much. Take care.
Bye.
Bye.
Bye.